Hey everyone, welcome to Be Divine, Be Well, where we will be discussing all things women's health. I'm Jess from Journey to Naturopathy, and I'm hoping you will leave these discussions more empowered to take control of your health, to ask the right questions, and to recognize that you are not alone. Today we'll be talking to Dr. Gina, a licensed ND based in BC, Canada. Her clinical focus is in fertility and women's health. She also has a beautiful puppy named Arlo who may actually make a brief appearance in this episode. Today's topic is PCOS or polycystic ovarian syndrome. It is thought to be the most common hormonal related disorder in women, so let's get started. This is definitely a topic that is super close to my heart. I have a couple cousins who had been diagnosed with it. I currently have hormonal imbalance, but they haven't officially diagnosed me with PCOS. And I think that's where I kind of want to start with it, defining what it is and talking a little bit about why it's so misdiagnosed in clinical settings.
So PCOS stands for polycystic ovarian syndrome. Sometimes people say polycystic ovary syndrome. And they're actually working on a name change because when I tell you the criteria, it doesn't really make sense. So you have to meet 2 out of 3 of the following criteria. So the first one is anovulation or amenorrhea or oligomenorrhea, meaning you have no periods for at least 3 months, or you have irregular periods where your cycles from like the first day of your period until the next day of your period are over 35 days. That would be classified as oligomenorrhea, so longer cycles. So you can have either no cycles or those irregular cycles. Criteria 2 is hyperandrogenism or high androgens. And this can be clinical, where just by looking at someone, you can see symptoms like oily skin or acne or hair loss, like on their temples, or hair growth. Sometimes it's like facial hair that's really thick or coarse, can be like between the breasts, on the abdomen, and the inner thighs. So these are all signs of high androgens. Or it could be on blood work. So you might actually look at someone's blood work and see that they have high testosterone or high DHEAS. So you can have either one of those to classify as hyperandrogenism. And then the other one is polycystic ovaries on transvaginal ultrasound. It's a wand, and they actually insert it into the vaginal canal, and they can see your ovaries and your uterus. You can actually see the follicles growing in the ovaries. So it's normal for people to have multiple follicles growing at once, but in PCOS, you'll see they call it like a string of pearl appearance, and it's basically more than 12 follicles per ovary. It depends on the ultrasound that they're using or the technology and how advanced it is, because typically it's 12 follicles per ovary, but with advancement, we can start to see more follicles. It's more high def, and you can see more. So depending on the technology, they'll use 25 or more follicles per ovary. So you might have irregular cycles and acne, and you classify as having PCOS. Therefore, you don't need polycystic ovaries to have polycystic ovarian syndrome. So that's why they're trying to change that name, because it's not really true to the characteristics that you need for the diagnosis. Or you may have really regular cycles and you think everything's great, but you have high testosterone on blood work and polycystic ovaries, which are both things you wouldn't actually know if you didn't have symptoms of the acne or the hirsutism. And that's why this condition is so common. We're seeing it in so many women, but it's underdiagnosed because you may not go in for that blood work or that ultrasound, and therefore we don't know if you qualify for those criteria. And a lot of the times we don't learn about reproductive health and hormones in depth enough in school, in like elementary school and high school, or even undergrad. So women don't really know, who to go to, or if it's irregular to have these symptoms, right? So I think that's why it's underdiagnosed. And also because maybe women aren't comfortable going to their doctor because they don't know the outcome. Maybe their doctor is unaware of the syndrome, or a lot of the times the only options for medical doctor are birth control or metformin, and maybe they don't want to provide that. It's challenging, and I hear so many women who say, I went to my doctor and they told me the only option was birth control. And so I didn't know I had no idea there was this whole other side of medicine that could really treat the underlying causes and get me back on track. So it's really, it kind of flies under the radar, and women unfortunately aren't really educated about it. And so I think as the awareness increases, then you'll see a lot more women being like, oh, well, I get my period every so often. It's not monthly, or I have acne. Maybe I should get tested for this. So and the other piece is that a lot of the times proper testing isn't done. So maybe the doctor is testing your FSH and LH levels, which are really important to look for in PCOS, but maybe they're not testing at the right days, or because you have to get your hormones tested at certain days, or maybe they don't run the full blood work that allows you to see maybe your testosterone being high, right? So it's really challenging to get a proper diagnosis, and also because a lot of women don't know, and the awareness really isn't there. So I think as things kind of get a little bit better and more education gets out, then women will start to understand it more and be able to treat it better. But yeah, it's unfortunately a very common disorder, and because there are so many different presentations and so many different causes, it's really hard to kind of nail it down.
Having the education, and that's a huge part of naturopathic medicine, is the doctor as teacher, being able to educate them about their cycles, what's normal, what to look out for, how we can help you, treating the root cause, which is something that I think is super powerful with women's health in terms of naturopathic medicine, because we look at that whole picture. And with a woman specifically, I think we have such a web of different systems and hormones and all of these factors that play a role in this, that it's so huge. And I think that's a huge thing about syndromes, is because it's not this direct A plus B equals C, and this is the disease you have. It's a syndrome, which means there's so many different causes. There's so many different symptoms and signs. The lab work, some people will have insulin resistance, some people won't. Some people will have the high testosterone and some will not. So I think that's definitely important to acknowledge. I wanted to ask, in terms of causes, I know there's a lot more research coming out from that, but what are some things that you would educate your patient to let them know what could have potentially caused this in the past, and how do you educate them on that?
In my webinar, I talk about 4 main causes. We're often talking about insulin resistance, adrenal dysfunction, androgen excess or hormonal imbalances. We also talk about endocrine disrupting chemicals, our environmental exposures, because that can have a huge effect. So there is so many different causes. And there's also something called post-pill PCOS, where after women come off the birth control pill, they have this syndrome that looks like PCOS because their cycles are irregular and they may get rebound acne, or maybe the blood work is even there. The thing that doesn't typically tend to be there in post-pill PCOS is the insulin resistance. So a lot of times you can test for that. It's so difficult because there's so much overlap with other conditions as well. Like maybe it looks like hypothyroidism. It's almost a diagnosis of exclusion, where you need to rule out those other things before you can truly rule in PCOS. And the other part of it is that traditionally this syndrome presented in women who were obese and had this hirsutism, or like this hair growth, or like the hair loss on their scalp. So when you go into a doctor that's not really up to date with that, they'll look at you and say, you don't have PCOS, you're not obese, you don't have the hirsutism, but there's lean PCOS and there's different presentations of PCOS. And so it's important to become empowered and advocate for yourself and say, I want the blood work and I want to get tested because I want to rule out this condition, because it is something that you can treat and you can reverse symptoms. You just need to know, I mean, A, do you have it? And B, where are those imbalances for you? So is it insulin resistance? Is it androgen excess? Is it adrenal dysfunction? And there is that whole education piece where if I have someone come in with hormonal imbalances or PCOS, I bring out my charts and I take them through what a regular menstrual cycle looks like, and I explain those hormonal fluctuations, and I show them the adrenal HPA axis, and I teach them about these things, because these are things that most people don't know. And so they're not understanding when you give them some blood work that says, oh, your LH is really high. What does that mean? Like, I understand that, okay, this is indicative of PCOS, but what does that truly mean? Why is this happening? You have to look at the pulses from the brain from GnRH. Why is that LH being high? I've done my job if I've educated someone and allowed them to make an informed decision. And that's really all what I'm about.
In terms of treatment, so obviously in the medical side of things, there's metformin, there's birth control. From the naturopathic side, maybe you can go a little bit into that. Obviously it depends on the person.
Yeah, like you said, naturopathic medicine is very individualized. So a lot of the time I'm doing lab work and we're asking a lot of questions that may not even sound like it's related to your condition, but it's all to get to the root cause for you. And then therefore our treatments are based on that. So it's not, oh, I have PCOS, what can I take? Because it might not work for you, because you might, for example, myo-inositol is a supplement that we often recommend. It's for insulin resistance and regulating your cycle. But if you're someone who doesn't really have those issues, then why would I prescribe that to you? You know? So it's not like, oh, give me the pill to fix it. It's We need to figure out where your imbalance is so that we can support you there. And that is kind of where you see improvements. Diet and lifestyle is always a foundation in PCOS. It's always where we're starting. You can't out supplement a poor diet. And because a lot of PCOS is driven by insulin resistance, we really need to work on blood sugar balancing. So that might look like reducing refined carbohydrates. And I'm not all about reducing carbs in general. Like, women need carbs for hormone function. Love healthy fats, love carbs, but choosing the proper carbs to help stabilize your blood sugar, incorporating healthy proteins and fats at every meal, more like berries for fruit versus maybe some sweeter things like watermelon or pineapples. And these are all discussions that we have, and we explain why in terms of like the glycemic index and the load and how insulin works. And then exercise is really important. You have to find a balance because you don't want to over exercise. That can kind of tax your adrenals and it can actually make things worse. But finding that balance in what works for someone and what they really enjoy. And then after we work on the dietary and like foundational lifestyle changes, we're typically using supplements to support like myo-inositol or N-acetylcysteine or berberine, or maybe it's saw palmetto if they have androgen excess. Vitamin D is a huge piece in my practice. It's really important for so many functions in our body. There's a receptor for vitamin D on virtually every cell in your body, so it's super important. And in terms of hormone regulation, that's a key piece. So I'm always testing vitamin D and dosing appropriately. Once you kind of like cover the bases, it gets more targeted towards specific symptoms or lab work. And again, like really individual approach. But there's a laundry list. Like, I could probably name 50 things that you could do for PCOS. And it's amazing. Like, we have such a good toolbox, such a variety, and something simple as like a spearmint tea. If you're not someone who can afford a lot of the expensive supplements, spearmint tea can really help to lower androgens. And that's something you can buy at a health food store or a grocery store for like $4. So I don't love just like throwing supplements at people and telling them they have to stay on them forever, because that's not true. Supplements should be targeted and used for a certain amount of time. And then you should retest and see progress. I've had patients in the past that we do the supplements and they don't do anything for them, but acupuncture is what works for them and to regulate their cycles. So sometimes we forget how powerful acupuncture can be in hormonal imbalances. And again, it's a targeted treatment that is you're choosing points that are specific for you. But there are points in the body that are really helpful in regulating menstrual cycle, depending on where you're using them in the cycle. So it is something that we recommend to do quite often, like once a week or once every 2 weeks if you can. That was the one thing that I've seen several patients respond to much greater than supplements. So everyone's different in their response as well. And so it's important that you are working with someone like a naturopathic doctor who can kind of tailor that to you, because you are an individual. And like you said, you might walk into my office and give me the exact same symptoms as the next person, but you have completely different treatment plans, or you're walking out with completely different things.
Telling people that there are other options is, again, in that education piece, because, you know, when they go to the doctor, they're not getting a lot of options. Like for me, I went to a gynecologist, I went to my family doctor, and I was really given that, well, you can't really do much about it, but we can put you on birth control pill. And that was just not an option for me at the time. For me, I didn't want to go down the hormonal route. Other people might want to do that, and that's okay. But knowing that there's those other options and you're not stuck with this condition feeling, you know, helpless. And I definitely personally have felt that. And that's where I also think the mental health piece does play a role in it, because cortisol and stress and sleep and all of those things have big impacts on your hormones, on your systems, on just everything. So
yeah, the HPA axis, I have a whole slide on it in my presentation, because, and I go in depth about it because it's a piece that we often forget. We always think about the insulin resistance and PCOS, and we always think about the androgens, but stress is a huge driving factor, and cortisol has so many effects on insulin. I have a diagram where it shows you basically like what affects what, and everything is affected by stress. So it can create insulin resistance. It can increase androgens. It can affect that LH response. It's something not simple to correct because we're all stressed, right? But there's things that we can do to support that. And it's important to not forget that piece of the puzzle, because a lot of the times that's a huge driving factor.
Like you said, some people might come in asymptomatic,
Yeah.
but other people might be having very serious symptoms, and their insulin resistance could be affecting all these other systems in their body. And so it's just very much that treat the whole person idea of it, and understanding that a woman's hormones affects their mood. It affects, their sex drive. It affects all of these other areas in their life that could be affecting now so many layers of their day-to-day life. Is this a condition that you can necessarily reverse? Obviously it differs, but.
Yeah, good question. So it is a syndrome. So it kind of tends to like wax and wane. So for example, you might have a period 1 month and then you get it the next month, which is like, oh wow, I have my period twice in a row, but then maybe you go like 4 months without it and then it comes back again. So it's hard to determine that because you might wax and wane out of the criteria. So I'll say that you can kind of reverse the symptoms or improve the symptoms and get your cycle back on track, but it tends to sort of kind of wave throughout time. So a lot of times if you aren't managing it or you kind of just like fall off track, you may notice that your cycles fall off track, or you get really stressed. You may notice your cycles fall off track and then your hormones can become imbalanced again. So it is kind of, you're trying to find the balance because it's affected by so many things, right? So it's really hard to keep your cortisol in check and your insulin in check. And you really have to be quite regimented to do that. But then, it's also causing stress. So because there's so many factors, it's difficult to fully treat it and be like done with it, right? But definitely 100% you can improve symptoms and reverse symptoms and then kind of like get out of that state where you're classified as having PCOS. It's a lifelong condition. So it is something that you do have to manage lifelong.
When you have someone with PCOS who doesn't want kids versus someone with PCOS who wants kids, I feel like the treatment plan would be a little bit different. What types of treatments might be changing amongst those individuals?
So it depends on when they're hoping to conceive, because if you are someone who's trying to conceive within the next few months, I wouldn't put you on berberine because that's a herb that's contraindicated in pregnancy. So if you got pregnant, I wouldn't want you on that herb. Maybe we would use NAC and myonostal instead, for example. The other piece, if you're trying to conceive, is optimizing egg quality. It takes an egg 120 days to mature. They're always constantly like turning over. But when we're talking about fertility, we really want to optimize your chances of conception. So it's ideally best to see a practitioner and work with them for at least 3 or 4 months before you actually try and conceive. And this is what we're doing in like IVF patients as well, because, they know when their retrieval date is. So oftentimes they're kind of scheduling ahead of time to work on their egg quality and work on hormone balancing. And it's because it takes an egg that long to mature. So if we're working on the eggs now, we know that they'll be hopefully a better quality in 4 months, but we don't want to work on them now and then you conceive next month because what we've done really hasn't had the chance to work. So timelines are more important when we're thinking about fertility and PCOS and egg quality parts of it, and then trying to provide the education piece on all the contraindications that we maybe would use these things in PCOS normally, but we can't use them or we're not super comfortable using them if you are actively trying to conceive right now. I do want to say though, a lot of people think PCOS is an infertility sentence. They think that because I have this condition, I can't conceive, but that is absolutely not true. A lot of people think PCOS is an infertility sentence. They think that because I have this condition, I can't conceive, but that is absolutely not true. There are so many women and women that I've worked with, even though I've been in practice for such a short period of time, who have PCOS and successfully have babies and healthy babies. And just because you have PCOS, maybe it will be a little bit challenging. Maybe it's not. Like maybe you get pregnant right away. But oftentimes we need to work on a few underlying things in order to kind of regulate the cycle and maybe work on like the underlying insulin resistance and things like that, correcting nutrient deficiencies, for example. But it by no means means that you can't get pregnant. You can absolutely get pregnant with PCOS and end up having a healthy pregnancy and a healthy delivery and a healthy baby in the end. So I try and emphasize that because a lot of women think that because they have PCOS, they can't get pregnant. And it's ultimately not true. It sometimes is more difficult because of the ovulation piece as well. If you're not ovulating, then you obviously can't get pregnant. As someone who has PCOS, receiving that diagnosis, it's a huge weight on your shoulders when you don't really know what you can do and you're thinking that maybe you can't have babies. But I just want to make sure people know that there are so many things you can do in terms of naturopathic medicine. There are so many ways that you can work on your underlying causes and get yourself back on track and really optimize a healthy pregnancy.
That's perfect. I mean, I definitely also in ways needed to hear that. I definitely think it's important for people to understand that with this condition, there is so many things that you can do. And a lot of the times, like what you said, a lot of the times people do not have problems conceiving. And so I think that's definitely something that a lot of women would love to know for sure.
Yeah, obviously working with a practitioner is a good thing, but even just providing that education and allowing these people to feel heard is a whole other piece of naturopathic medicine that I love.
Yeah, and the knowledge is power piece for women especially. I genuinely feel like, you know, our bodies are constantly changing when you go into pregnancy, when you're going into postpartum, when you have menopause, perimenopause, like all of these different stages in your life. Actually understanding the cycle and hormones and where they're produced and how they're produced and the brain's function and the gut health and all these components that affect those huge aspects in women's lives empowers them to feel more comfortable speaking up for their health and asking the questions. It's such an amazing like line of work. I'm very excited.
Yeah, I'm so happy that you're exciting, and it's very rewarding. And when you're passionate about it, it's just fun. It's so fun to work with these women and provide them that education that they may not have known. And it's amazing to see how grateful and appreciative they are for what to us seems like the simplest things, because it's ingrained in our head. We have this knowledge. We're so fortunate to have this knowledge, but some people aren't. And providing them this simple, you know, this is what your menstrual cycle looks like and this is what's happening, even that simple education is something that they may not have learned in their past, and it can be so empowering and so helpful for them. And so it makes me so happy every day to be able to help these women, and that's why I chose to do this field of work and why I love it so much.
I hope you all enjoyed today's episode and learned something new. Please comment below any questions you have or topics you want to learn more about. You can follow me on Instagram at Journey to Naturopathy to keep up to date with any resources and upcoming content. Thanks for watching, and stay tuned for the next episode of Be Divine, Be Well.